We clean interdental areas, places, okay, and then we keep that area clean, but somehow we chew unilaterally from one side. She is a left-handed,
Right.
right-handed. So majorly contralateral side we put our first जो कॉर होता है हमारे चंक ऑफ फूड, तो उसी तरफ से हम यूनिलैटरली च्यू करते हैं. तो नोटिस करिएगा कि डज शी च्यू फ्रॉम द राइट साइड मोर और लेफ्ट साइड मोर, ओके, without noticing her, without informing her, just notice from the distance. Okay? If she chew more from right side, although she is not doing that right now because she is having a pain on that cavitative tooth, but after that, if the habit persists, she will again start chewing on the right side if the pain gets released. So this shows that if we chew unilaterally from one side, the chances of food lodgement or food infection will be the more on that side, and we seldomly see such kind of cavity presentation where child is having no cavity regions anywhere in the mouth, but only at the one area in between two teeth. This is very rare, and it's a site specific due to the habitual eating habit on the one side, especially upper tooth, which we usually forgot to see or we can't visualize that space. Lower tooth we can easily see, but upper tooth we don't able to see usually while we're in standing or sitting position. We can't go and watch like this. Okay? So flossing is the main thing we can prevent such kind of cavities, and you can start on that. And first, she is having very good developing face. Instead of that, she is having an open mouth posture. So I want to ask you, does she has any allergic rhinitis or anything related to the nasal cavity or any tonsillitis, adenoids, or do you visit to an ENT surgeon for her problems anytime?
Yeah,
Especially at the age of 3 or 5 years.
Yes, many times because she was born and brought up in Bangalore. So from by birth she had this constant nose blockage.
Okay.
So they said that she's allergic to some pollens and things like that. So that has been a constant issue. So all the time I'm nebulizing. But from the time we were shifted to Indore, the nose blockage is not there.
Okay. So welcome to Indore because it is less polluted area.
Yeah.
Okay.
So
and, yes.
I'm relieved that she was having 12 months nasal block continuous, and because of which, her mouth
when
used
it
to
was
be
happened?
But from birth, I have seen that thing,
Okay.
that issue. So she was on meta spray or that was on some sprays there, or some or the other, and nebulizing was there. And when she reached 5 years, like she had a severe nasal infection and it accompanied with tonsils. Yeah.
Okay. So do you consulted any AD?
Yes, at that time I had consulted there. So they asked me to do a surgery in the nose that time.
Okay,
but
for
then
the septal deviation or some polyps are there?
That they have not mentioned.
Does they do any endoscopy and intranasal examination?
No, they haven't. They just told me that there might be like you might have to go.
We can't tell this such kind because
Yeah.
I suppose that a surgeon should not or will not advise you this for surgery before endoscopy.
Yeah.
Might be he's expecting something
Yes,
like that.
Yes.
But
that is what they said, that you might have to go for a surgery, but there has to be a detailed checkup that is to be done. So I was like very apprehensive because whenever we used to come to the northern part of India, be it Delhi or this part, her nose used to be clear. Like there were no tonsillitis.
So how long since you are in Indore?
It's been almost a year now.
Okay. And she is not having any kind of problem.
No.
Okay. So welcome to the cleanest city of India. Okay. And I want to explain you a simple thing. I just want to ask you what about the dark circles she is having? Is it she is having since long time or
no,
are they increasing or are they decreasing?
No, off lately just because we have been traveling, so her sleep cycles have got haywire. She used to sleep by 9:30, 10 maximum, but now it is like because we have been traveling a lot since past 2-3 months, so because of the day, night, and all those things.
Do you breastfeed her properly?
I did breastfeed her almost for 2 years.
2 years. Good. So it's very good. She's having a very good face, but due to the nasal congestion in the initial years, she developed a reflex from where she started breathing through her mouth. So what you have to notice today or in 2-3 days, does she breathe through her mouth? Okay. How can you assist? It's very simple technique. Just in the deep sleep, just pinch her nose or close her lips. First close her lips and see whether she is developing any hunger for breath. Okay. Do it for a 5 seconds. Don't struggle. You will find very finally the body movement, the hunger will start for the breath. If she repeated you find this finding repeatedly twice or thrice, we'll work on her oral breathing. Okay, because she developed a habitual oral breathing. Okay, right now she can breathe through her nose. Nose is all clear, but the muscle tonicity and the neuromuscular coordination she developed in the first year of life due to the condition of that. So we have to rehab these muscles. Okay, we are going to rehab this muscle. It's very simple procedure. We will just guide you, and you can do it at your home. There will be no medicine. There will be no any other involvement. Just you have to do on yourself. Okay, we'll do some exercise. We'll use some yoga, pranayama, and some postural exercise, reminder exercise, and we'll do. But you have to give me this findings. Does she have any hunger for breath when you close her lips? Okay, first thing. Then she is having a very good jaw. The teeth are arranged very nicely in line. Upper jaw is wide enough to provide a space. And again, one thing you can do, you can check for the lingual palatal suction. Okay, how can you check? When she is in deep sleep, just pull down this chin down, or you can record a video and send it to me. You have to see where the tongue lies and repeat it 2-3 days. Okay, in the one visit, in the one shot, we can't find it because maybe the child is not in deep sleep, maybe she woke up. Okay, so repeatedly you have to say around 10 times you have to see. If we find 7 or 8 times or 9 times, then we have to do that. If the tongue is on palate while in deep subconscious mind, the rest position of tongue is on palate, that's very fine, and what is the ideal which we require. Okay, and it is required for the development of upper jaw. And in previous many videos I explained how an upper jaw is a reference point for the development of our brain, our lower mid face or our lower jaw, because it's create a beauty, and this chin is called as a beauty bone. If you see in the modeling industry, this chin represents our beauty. Okay, and especially the eyeballs, lower margin of eyeballs, these are supported by the maxillary nose, shape of nose. So I am talking about the functional dentistry, how the function like breathing, chewing, speaking, swallowing affects the bone around that, affects the muscle around that, and how muscle affects the growth and modulation, remodeling of bone on that, and how it all influence the shape of face and the space, three-dimensional space, what these all space like mouth space, nasal space, airway space. So these all are space. It's like a room. If we congest it with all the furniture and all that, we can't utilize the space what we meant for that. But if all the things are in proper arrangement or what we need, it's there in the room, no extra furniture and all that, we'll feel comfortable in that room or in that home. So we need space for chewing, we need space for breathing, we need space for speech, all the functions. By discussing your case, it's give me an opportunity to connect to other people, other parents. They can easily assess this kind of things. If you find such kind of problems, just you have to, anyone can give me a WhatsApp photograph, video of their child's face, and we can discuss on that how the functions we can alter, we can rehab that functions and get a very good growth without any appliance, without any treatment, without any medicine, without paying doctor to a heavy fee at your comfort of your home. And the benefit is to the whole body. If you correctly breathe, you develop your face, and if you breathe correctly, the oxygenation of the body, the brain, all goes. Okay. So this is the point I want to add to your discussion, and I am very much happy about her. The spaces in the front teeth, don't bother about this right now. Okay, this will go off or will look after that in at the age of 12 or 14 years. But if any child is having a crowding, okay, if you feel any crowding, a tooth on the tooth, one tooth is forward, one is upward, not in line, especially upper one or lower front one, then the parents has to bother. They has to attend a pediatric dental clinic and get it diagnosed, discuss with the doctor, and start a treatment plan. Especially this all concept comes around the concept called as orthotropics, which says if the tongue is on palate, lips are close together, and teeth joint in the contact. Say for example 4 to 8 hours a day, or when you are in the subconscious mind, like you are watching a TV, like you are driving a car, or if you are reading, if you are sleeping. So this is subconscious mind. Okay? So if you do that, you will get a better face. Okay? Okay? Thank you for that.